Okay, welcome back. My name is Dr. David Kunashko. I'm the medical director here at BIOFLEX Laser Therapy, and I thank you for joining me today for today's webinar on BIOFLEX Personal Therapy Systems for tennis and golfer's elbow. I thought I would revisit this topic because this time of year, I think we're all starting to get a little bit more active and maybe going out there and hitting a few golf balls or starting to play tennis again. Although, of course, this condition is very common and most common in people that don't even play those sports. So I did want to chat a bit about how BIOFLEX personal therapy systems can actually help this condition and sort of give a background as to what these conditions are. I think a lot of people don't have a really good handle on what it is, what they're dealing with, and how to get it better. So that's why I wanted to talk about that today. As usual, the webinar will be recorded, and eventually, within a week or so, it should be posted up on our website. On our website, if you go to BioCare Plus, and then you'll go to customer support, and you'll see two icons for webinars. One is for personal therapy system webinars, and the other one icon is for professional therapy system webinars. So I'm going to talk a bit about, again, an overview of our personal therapy light systems, a review of tennis elbow and golfer's elbow so we can understand what it is we're dealing with. We'll talk a bit about treatment that is commonly used for tennis elbow and golfer's elbow and why you would want to use Photobiomodulation therapy, or PBMT, which is what BIOFLEX personal therapy systems are. And then I'll get into about how you would approach treating these conditions using our systems. At any given time, I encourage you to ask questions. I will definitely answer those questions at the end of the webinar. So I would encourage you to type them into the Q&A box as opposed to the chat box. And at the very end, I'll go over those questions, okay? Okay, so we actually do manufacture two types of personal therapy systems, the BIOFLEX 120, P120, and the personal system P180. The differences really have to do with the amount of energy being delivered into the tissues, the 180 having 60 more diodes and slightly greater power, covering larger surface area, and the 120 being obviously a little bit smaller than that. So the device itself consists of bicolor superluminous diodes. It's a special type of LED, and they emit, each diode emits two wavelengths, red and near infrared. And today's topic isn't going to talk about why red, why near infrared, and all that. I've done that in the past. And if you're new to listening in, then I encourage you to go to our website and watch some of the previous webinars to give you a bit more of an education on what it is we do and why these light diodes help to heal tissues. So as far as how you're going to approach treating these conditions, obviously, we're going to be interested in the elbow. So it's the elbow icon on your controller. That's the series of protocols that you'll be using for both tennis elbow and golfer's elbow. Of course, at the bottom of your system, there is a power button, a stop button, a start and pause button, and a select stage, which is basically intensity with respect to the amount of energy and how it's delivered into the tissues. And I'll reference that at the end of today's webinar as well. So when you're dealing with tennis elbow and golfer's elbow, that's the common, term that we hear about. Us clinicians, we usually refer to as epicondylitis, and even that term isn't really overly accurate. There's lateral and medial epicondylitis. Lateral is tennis elbow on the outside of your arm, and medial is golfer's elbow, which is on the inside of your elbow. If you look carefully here, you'll see a series of muscles. These are the extensor muscles that come together to originate in what's called a common extensor tendon around the elbow. And what you really have to pay attention to is one specific muscle called the extensor carpi radialis brevis, or ECRB for short. Don't worry, there's no test at the end of this webinar. If you follow this muscle, it passes over a couple of bumps. One is the capitulum, which is on the actual elbow itself, and the other is the radial head. And its location is critical because those bumps actually increase the movement of this tendon, specifically of this muscle, and increases tension and stress. And it's thought, although again, not 100% sure, that is the location of the specific muscle that tends to cause a lot of the issues with tennis elbow. So that's the one that we tend to try and target with different techniques. In a clinical setting. I'm a chiropractor, but whether you're a chiropractor or a massage therapist or physiotherapist, oftentimes you're looking at that specific muscle to tackle. But the other muscles can also be involved as well too. So this is on the outside of your elbow. Again, this is what we're dealing with tennis elbow. For golfer's elbow, which by the way is rarer than tennis elbow, they say about 10 times rarer, and that's on the inside of the elbow. And instead of the extensors, we're dealing with flexor muscles. So these are the ones that flex your wrist and your hand, and they form a common flexor tendon, again, on the inside of your elbow. And this is where the issues are with golfer's elbow. Both tennis and golfer's elbow is considered, or are considered to be a tendinopathy, which is basically a clinical syndrome that involves a tendon, typically with pain, obviously. May have some swelling, and oftentimes there's functional impairment, meaning that you have difficulties gripping or using your hand or your wrist, or even at your elbow as well too, right? So technically, it's really considered what's called a tendinosis, which is a degenerative, non-inflammatory process that causes disorganized collagen structure. So even though it's really painful, it's not so much, the pain isn't related to an acute inflammatory response like a tendinitis, for example. A tendinitis, which at the elbow is pretty rare. You'll see it more in the Achilles tendon, but tendinitis is an acute inflammatory process. So that usually occurs when you overuse something doing something, and immediately you have pain at that tendon. So it creates a reactive acute inflammatory process, but that can lead to tendinosis and tennis and golfer's elbow as well. But typically when we talk about tennis elbow and golfer's elbow, we're really referring to more of a chronic problem. And this is really important because chronic problems take a long time to get better. And hence, if you've ever had tennis elbow or golfer's elbow, you certainly know that it's not something that goes away in a few days or even a week or oftentimes a month. The stats seem to indicate that approximately 3% of the adult population, especially in middle age, whatever that is nowadays, but 40s, 50s, I guess, 3% of those people will be walking around with a sore elbow because of tennis elbow or golfer's elbow. So it's actually fairly common in the general public. And again, you don't have to be playing these sports. It's often just doing other things, whether it's gardening or work related or what have you, but it tends to be an overuse kind of scenario. Usually it's self-limiting, meaning if you leave it alone, don't touch it, let it heal, don't aggravate it, it will get better on its own. But of course, we never do that. So typically it doesn't get better on its own. And it takes a long time. It can take up to a year to a year and a half. But sometimes it can actually be quite persistent and come back or never really go away. And this is in about 10% of the population that get tennis elbow and golfer's elbow. So this is a really major problem because it's really debilitating. It tends to occur, by the way, most commonly in your dominant arm, although it can occur in both. But that makes sense because that's the arm that you're using and doing things a lot with. Age is definitely a factor, and that's because there's an increased prevalence of degenerative changes. As we get older, we degenerate. And so there's decreased cellularity, which basically means there's a decreased tendon cells. And there's something called an increase in glycosaminoglycan, which is sort of like a gel-like structure in and around the tendon cells, the tendon itself. And the tendon itself actually lacks really the nice fiber organization that a younger tendon or uninjured tendon would have. As I mentioned earlier, tennis elbow is about 10 times more common than golfer's elbow. And of course, as the tendon ages, it's less elastic as well. So being less elastic is less resilient to tendon changes or the way we use it as well. So we need to be careful on, if we are playing sports, how we're gripping. I play squash, and it's really critical when you're playing squash that you don't grip the handle really tightly. That will lead to issues at the elbow, especially tennis elbow. And if the grip is too large in circumference or too small, that can also create problems as well. So you need to make sure that your circumference is comfortable and you're not gripping too hard, because that does lead to more incidences. So again, I mentioned previously it was considered to be a tendonitis condition, but now we know that it's more than likely a chronic issue. There aren't that many inflammatory cells in these kinds of conditions. So it's a degenerative process. It's really important to ensure that you rest your elbow. If you're not going to rest it, it's not going to get better. In this story. So, what can I say? If people come in all the time, we try and treat them and they're not getting better, and it's because they continue to do the activity. Now, I get it. If you're working and you have that kind of scenario, it can be challenging, but that's why you should be on modified duties or have something of that nature. Otherwise, it really does take a long time, if not becomes chronic, if you're not able to properly rest it as part of your treatment regime. Rehabilitation is critical. So, light therapy, laser therapy is really helpful for this condition. But if you're not doing other things, then you can't just rely on say BIOFLEX to heal it up. You need to do other things, especially exercises. And if you don't know what kinds of exercises you should be doing, go seek a professional, right? Chiropractor, physiotherapist, massage therapist, osteopath, whoever. But it's critical that you learn how to do these exercises properly, what exercises to do. Then you can do them at home. But otherwise, if you're not doing them properly, you don't know what to do, then it's not going to be very helpful. Symptom-wise, I think we all understand there's going to be pain. It can be related to exercises or activity, or even afterwards. There can be stiffness as well, especially upon weight bearing or after prolonged immobility. So you wake up in the morning and you go to use your elbow and it feels kind of stiff and tight, that kind of scenario. It can commence at the beginning of their exercise as well, but then kind of loosen up. So that's not atypical either. However, as the condition worsens, there can be a progression of the pain. So it might be felt more towards the end of the exercise session as well, or even throughout the duration of the activity. As far as microscopic view, I'm not going to go into huge detail on this, but I do want to give you a visual as to what's going on. So what happens is there's a lot of accumulation of immature collagen. The body's trying to repair some of the microscopic tears that go on, and the collagen repair is incomplete, and you start to get this sort of what's called type 3 collagen, which is not the nice linear sort of wave-like collagen tendrils that you would normally have. There's an increase in what's called ground substance, which is just like a kind of fluid in between the collagen. There tends to be increased in blood vessels, but the immature blood vessels are not the kind of ones that you actually want. In a tendon, tendons actually don't normally have a lot of blood vessels, and you lose a continuity of the collagen. I'll try and show you that in the next few slides. So this is a normal, healthy tendon. What you're seeing here in the tendon are these sort of wave-like collagen fibers, and there's these little dots or tenocytes which is a form of a fibroblast cell that secretes collagen. You don't see many blood vessels. So that's a normal, healthy tendon. It looks kind of, all linear, kind of parallel. That's what it would look like if you took a microscope to it. In a grade 1 tennis elbow or golfer's elbow, what happens is you start to see, if you look at it carefully, you start to see these waves, these big waves form. You start to see proliferation of cells and clustering of them instead of being spread out. So the collagen fibers kind of loosen up, you might say. This is a very beginning stage. Sometimes it may not even be symptomatic at this point, but it's brewing. It's starting. And, if you don't pay attention to it, or you don't take preventative precautions, then eventually it can progress. The grade 2 tendinopathy, by the way, the only way you can tell this is if you actually have a sample of your tendon, and you don't normally do that. You don't normally take a biopsy for a tendinopathy. Here you can start to see a lot more cell proliferation and clustering, and you start to see what's referred to as angiogenesis or angiofibroblastic hyperplasia, which is just a fancy way of saying there's more of these immature blood vessels in and around these tenocytes or fibroblasts as well. This is not what you want. So you start to get more of a cellular-like structure in the tendon instead of more of the collagen. So this makes it weaker, which is more prone to tear. As you can see this sort of dark area here, that's a bit of a tear. In grade 3 tendinopathy, now you start to get some major issues. You start to see cells start to die off. That's called apoptosis or cellular death. There's an increase in cell migration. You can see all those little black dots, that's the cells. And an increase in something called matrix metalloproteinase or MMP, which sounds complicated. I suppose it is, but essentially what that does is it breaks down the matrix and it breaks down the tendon. So it actually kind of starts to make it weaker as well. By the time you get to grade 4, not a good scenario. Now you start to have significant cellular death, mechanical failure, quite large tearing. You're basically doomed for surgery at this point, and it's not a good result typically. So you never want to get it to this point, which is why you need to listen to your body and make sure you take the time to let it heal properly. If you don't do that, it's just going to slowly progress. So tendon healing itself is a continuous process. Basically, there's a certain amount of tension that occurs across fibroblasts when muscles contract and pull on the tendon. And this tension actually kind of aligns the cells and the collagen that's secreted. So there's a specific type of exercise called eccentric loading exercise that helps this to be established. And so it's a really important exercise to do. Tendons can take a long time to heal, 100 days plus days to make new collagen. So, you're dealing with a significant period of time. Bracing always comes up. I myself do wear a brace, and I've had tennis elbow multiple times. You think I'd listen to my own advice, right? But, and I've just gotten over about it. It took me 9 months maybe to get to the point where it's gone. Thankfully, it is gone. And I did wear a brace, but to be honest, the research doesn't show that it's actually going to help it heal any faster. What it may do is offload mechanical stress on that muscle I mentioned earlier, the extensor carpi radialis brevis. And it's important you know how to apply the brace. You should get a brace that has a little spongy bump to it. And that sort of compression pad should be placed just over the sore spot and over where that tendon overrides those bumpy areas, or even just a little bit distal to that. You can play around with it and maybe, again, seek the advice of a good healthcare professional and maybe put a little black dot on there or something like that, so you know exactly where to put it. Because if you don't put it in the correct position, it's probably not going to do a lot. And it's really important that if you want this to help, even though it says the evidence is poor, but I think it does help, at least for symptomatic relief. If you're doing stuff, then you should know how to apply the braces for sure. Exercises, my point of this webinar is not to go over, all the exercises, but there are a whole bunch of very good exercises that you need to do consistently and repetitively on a daily basis, if not multiple times during the day, to help out this condition. So there's eccentric loading exercises, there's stretching, there's isometric exercises. There's quite a few that you should learn how to do. And again, I would seek a healthcare professional to guide you on that specifically. Some other treatments that come up that we hear about are shockwave. And shockwave, claims a lot of different things, but the meta-analysis studies or systematic review studies, which are the highest quality level of studies, still don't really show that there's really much evidence that there's great benefits. In fact, they basically show it's equivalent to a placebo. So I don't know. I mean, I've heard some patients say it helped, but then I've heard it come back. So I think the idea with shockwave, if you do shockwave, you better be doing other things as well. And personally, I would be doing laser therapy as well, or light therapy, because it's going to help that process of healing that the shockwave kind of reinitiated. There's injections too, like corticosteroids, prolotherapy, botulism or botulinum toxin, autologous blood, and PRP, a whole bunch of different things. I would definitely not recommend corticosteroids. Corticosteroids is just really no evidence. In fact, it may make things worse. And NSAIDs as well too, non-steroidal anti-inflammatory injections tend not to help, because this is a chronic degenerative process, not an acute inflammatory process. So it can actually make the tendon weaker over a period of time and increase the likelihood of rupture. So not really keen on that. The evidence is quite clear on cortisone injections that it should not be done for tennis elbow, according to latest journals, that this one I've referenced here as well too. So I won't go into detail on it, but and the research does show that it's probably not a good idea to do that. But you may want to consider some newer techniques. One is called autologous differentiated fibroblast or tenocyte injection. Basically, what this is it takes your own fibroblasts. Usually get it from the skin, but the best ones are from your own tendon. They have a way of extracting it and then kind of growing it and then re-injecting it into the injured area. Probably expensive, probably not covered by any health plan, but it's showing really good evidence that it can be very helpful. Because what it's doing is it's actually putting in healthy cells, the cells that those tendons need to heal, and then they help to repair. But you know what? Light therapy does something pretty similar for a lot cheaper and a lot, you might say, safer as well. So I mean, I would be doing light therapy for sure. And if you have the bucks, you might want to look at some experimental injections like this as well. PRP may also be helpful as well, which would be a cheaper option there as well. So light therapy is going to help improve collagen fiber organization. It seems to help the immature collagen mature and help their alignment, along with the eccentric loading exercises. It helps the formation of mature collagen or type 1 collagen. And it down-regulates. Remember I mentioned earlier MMP, which is an enzyme that degrades stuff and is not good. It actually down-regulates, meaning it causes the cells to release less of this enzyme and therefore less degradation. So over a period of time, phototherapy or photobiomodulation will reduce MMP activity, which of course is beneficial. And of course, it can help accelerate regeneration and healing of the cells inside the tendon and the muscle as well. It can reduce fibrosis, and it can temporarily increase something called reactive oxygen species, or ROS. And these are chemically active molecules that play a role in something called cell signaling, which essentially helps the cells undergo mitosis and repair. So it's just an important mediator that light therapy is known to induce as well. When you look at some of the evidence for phototherapy, it is actually part of evidence-based guidelines according to the British Medical Journal. And specifically when they investigated tennis elbow and they found that, again, it can be self-limiting, but a certain percentage will persist. They say 20%, I read 10%, but anywhere probably 10 to 20% of people, probably closer to 20%, it can persist. So what they found with respect to low-level laser therapy or photobiomodulation therapy, that it's likely to be beneficial, especially for short-term pain relief, but also improved function, which basically means is helping the tissues to heal as well. So with respect to using BIOFLEX, obviously you're going to use the elbow protocol. For tennis elbow, that's on the outside, I'm going to recommend two placements. One is directly over the tendon origin, which is at that lateral elbow where the bony bumps are at the side of your elbow, or that's called the lateral epicondyle and the radial head. I mentioned a few of the other ones. You're going to place the pad over that area. And the second placement, I would like you to place more over the muscle belly or the extensor muscles, again, because the muscles tend to be also quite tender and oftentimes symptomatic. So two placements like that would be a good idea. Similarly, on the inside of the elbow, if you have a golfer's elbow, then you're going to place the array over the origin of the tendons, again, at the bony bumps of the inside of your elbow, and similarly place it over the muscle bellies of the flexor muscles of your forearm as well. So those two placements would also be beneficial. Treatment stages wise, remember that we're always going to start at the lowest stage. And in fact, usually those are the ones that are most helpful. There are 4-stage levels. One is the lowest amount of energy and the lowest amount of pulses or pulse rate, you might say. And then once you start at level 1, continue it for quite a few treatments. I mean, up to 8 or even 10 sessions for at least a couple of weeks before you think about moving it to the next stage, because especially in tennis elbow and golfer's elbow, it takes a long time to respond. So don't expect, changes quickly. And remember, you're resting it. You're using a brace, you're doing exercises, all these kinds of things are going to be helpful as well. Eventually, if you feel your symptoms aren't improving, then you can jump up to the next stage, but just, ease into that, okay? If you feel symptoms are not improving at all over a period of time, you need to understand maybe there's other complicating factors. Maybe it's worse than you thought. Maybe it's a higher level stage of the pathology. There's lots of potential things that you need to be aware of. But again, don't advance the stages too quickly. Make sure you're dealing with what you think you should be dealing with, right? Maybe it's a different diagnosis. Maybe you have a bone spur. Maybe there's something else going on. Avoid aggravating the symptoms. Listen to your body. And I know that's hard. I know you want to play golf, you want to play tennis, or you want to do whatever gardening it is. But you need to listen to your body. Otherwise, it's not going to get better in a quick time frame. Sometimes you might want to just stop using the BIOFLEX, maybe give it a break for a week or two, and then reinitiate. Sometimes that's helpful as well too. As far as a general treatment plan goes, I would say if you have an acute flare-up, you're going to treat 4. So if it's really quite tender, not necessarily do I mean acute inflammation, but I mean like, wow, it's really painful. Then treat 4, 5, 6, 7 days in a row, and then start to treat every other day. But if it's a kind of lingering or kind of low grade, you can start off treating every other day. That's usually is quite helpful after that. And once you feel you're getting, around 40, 50% better, then you can kind of, reduce the number of sessions. But again, it's not going to hurt to treat more, but it may not be necessary as you start to get closer and closer to the tissues being healed. So eventually you can tailor it off, once or twice a week as well. And if you have a history of tennis elbow or golfer's elbow, I would still treat it, even if it's feeling pretty good, several times a month, just to kind of make sure the tissue is healthy. And again, preventatively, maybe use a brace and do other techniques and stretches proactively. Some upcoming events, we have a masterclass coming up on June the 11th. The featured speaker is Dr. Norman Deutsch, who's written 2 bestsellers on neuroplasticity. Those of you who know BIOFLEX know that Norman had a close relationship with Dr. Fred Kahn, who passed away last year. And so Norman has graciously accepted an invitation to speak a little bit about his work in neuroplasticity. He's a really fascinating guy. If you've never heard him speak, he's quite dynamic. And this is your chance, by the way, to actually ask him questions. It will be a Q&A kind of session, and it will be a bit of an impromptu interview with him. I think you should find it really fascinating. So if you're interested in it, there's an early bird. Just go to our website, and you'll find it under events as well too. And lastly, we are doing some ongoing research, including into concussions. If you know someone or you yourself have had a concussion, then reach out to us. The email is research@bioflexlaser.com. That takes you to Dr. Randy Santiago, our clinical research director. We're doing a trial in Toronto and in Vancouver in combination with NeuroCatch, which is an EEG assessment tool as well. So if you have anyone or know anyone that might be interested in setting up or signing up for this study, we would love to hear from those folks for sure.